Hello and welcome to today's session on improving ECG safety, reliability, efficiency and cost-effectiveness using single patient use ECG leads. I'm Dr. Adam Osomanski. I'm an Australian anaesthesiologist and retrieval medicine specialist. I'm Senior Lecturer at Western Sydney University. I'm passionate about quality and safety, human factors, innovation, technology and simulation-based education in healthcare. Today, we'll talk about the importance of high-quality ECG traces in diverse clinical settings. We will discuss some of the clinical applications and advantages of single-patient use ECG leads. Some of these are to reduce cross-infection and cross-contamination risks, to improve clinician workflow efficiency, to enhance the quality and reliability of ECG monitoring, and to achieve economic benefits associated with the use of the single lead set throughout the patient journey. Finally, we would like to emphasise the importance of promoting patient safety and individualised patient care across the healthcare continuum. In this session, we will present a short case study involving a hospitalised patient's journey to illustrate some of the points raised above. I'll also answer a few questions in a brief interview. ECG is one of the most important and widely used clinical diagnostic technologies. Consistent, high-quality recordings and monitor traces are essential in high-stakes, high-reliability settings, such as intensive care units, cardiac catheter labs, coronary care units, cardiac surgical units, emergency departments, pre-hospital medicine and ambulance services, operating theatres, and wherever rapid, reliable diagnosis of ECG abnormalities informs clinical decision-making and has an impact on patient survival and patient safety. ECG electrode and lead systems are used for short-term and long-term monitoring throughout a patient's journey, in acute care as well as ambulatory and outpatient settings, in inpatient surgical and day surgery settings, for electrodiagnostic as well as surveillance and monitoring purposes. ECG is used in both emergency and elective settings, for post-resuscitation care, and in a variety of ECG-enabled devices and applications, including synchronized cardioversion and defibrillation, transesophageal echocardiography, electrophysiology and interventional cardiology, external pacing, lithotripsy, and intra-aortic balloon pumps, to name a few. A single patient use ECG lead set can follow a patient through a potentially prolonged hospital admission, across multiple interfaces of care, from pre-hospital to emergency department, through interventional and operating suites, to ICU and then to the wards, offsetting many of the limitations of reusable ECG leads. Monitor compatibility can be assured using universal lead adapters, and there are potential cost savings from using a single lead set throughout the patient's study. Single patient use electrodes have significant usability, safety, infection control, and economic benefits. Single patient use ECG leads can save time and improve patient comfort by reducing ECG disconnect-reconnect cycles at interfaces of care, where monitors often differ between departments. This also improves patient handover and transfer efficiency. Single patient use ECG leads can help preserve skin integrity, particularly in the elderly. There's no need to remove and replace electrodes. They can improve consistency and reliability of ECG traces by reducing potential lead swap and lead position variance errors. ECG artifacts can be reduced, and false alarms due to deteriorated reusable leads can be reduced. This saves nursing time and decreases alarm fatigue due to false alarms, which can desensitize clinical staff, interrupt care, and potentially compromise the care of critically ill or deteriorating patients. Single patient use ECG leads can reduce hospital-acquired infection risk and reduce equipment contamination issues associated with reusable ECG leads, which can harbour residual infectious contaminants. They can save valuable clinical care time and reduce interruptions to essential patient care duties by freeing nurses from time-consuming and effortful cleaning tasks. This 60-year-old female patient presents to the emergency department of a large regional hospital with new onset severe exertional chest pain and dyspnea after moving hay bales on her farm. She has a long history of hypertension, tobacco smoking, and drinks alcohol socially. It has now been over an hour since the onset of her angina symptoms at home. The emergency department team has assessed the patient according to local evidence-based best practice guidelines, using a standardised tool, such as the Clinical Pathway for Acute Coronary Syndrome Assessment. She has 12-lead ECG findings indicating an ST elevation myocardial infarction, an elevated serum troponin level, and atrial fibrillation. This is a life-threatening medical emergency. Immediate treatment of the patient's AMI and arrhythmia is commenced in accordance with the Acute Coronary Syndrome Reperfusion Flowchart and Acute Coronary Syndrome Reperfusion Checklist, or other appropriate guidelines. This includes the administration of appropriate anticoagulants. Urgent percutaneous coronary intervention, or PCI, is indicated, and the patient is safely transferred with full monitoring to the cardiac catheter laboratory. The patient has undergone successful percutaneous coronary intervention and treatment of her atrial fibrillation. She's been transferred to the coronary care unit for further management and will be stepped down to the ward before commencing cardiac rehabilitation. So I became interested in patient monitoring quite early on in my career. As a medical student in the 1980s, and then as a junior doctor in the 1990s and moving forward, I was exposed to a lot of changes in how we monitored our patients, as well as some pioneers who were developing and innovating in the space of ECG and other monitoring technologies, and I really felt inspired about that. Also, as an anesthesiologist, we're very interested in monitoring physiological parameters in real time, and also using data that's been previously acquired, for example 12-lead ECGs as a good example, or echocardiography data. So being able to understand the technology really helped me, and still does help me, to better appreciate what the capabilities of it are and what the limitations are as well, what's possible. And moving forward, I think we live in very exciting times, thinking about the changes and evolutions in monitoring technology that we are now seeing. The technology of ECG lead wires and electrodes has evolved enormously over the course of my clinical practice. As a medical student and then as a junior doctor in the 1980s and 90s, we used ECGs quite extensively, but it was a very labour-intensive process acquiring a 12-lead ECG. We had silver-plated suction cup electrodes and silver chloride paste attached to lead wires that would often fracture or disconnect from the suction cup electrode. The electrodes would fall off, and then you had to acquire the ECG itself in real time, and so it would print a paper strip that you had to then mount on a piece of adhesive paper, and then go through the process of interpreting. Earlier monitoring technology was much simpler. Fewer lead options were available. There was less opportunity to detect ischemia or even arrhythmias, and over time the sensitivity of the instrumentation has improved. things have become miniaturized. We've seen the much more reliable equipment developed that's portable, that runs on rechargeable batteries, for example. Moving forward now incorporates machine learning and AI-based diagnosis for both diagnostic ECGs and also for real-time monitoring and telemetry. So we've seen some amazing evolutions over time, and I think we'll continue to see more and more progress looking to the future. So the way I see the field of patient monitoring evolving in the future, including the role of single patient use technology, is very much, I think, dependent on three things. Firstly, further miniaturization and the use of wearable technology such as smartwatches, the use of AI and machine learning to provide much more reliable diagnosis and to make what's often what can be a difficult diagnosis for a human operator much easier and more reliable, and that has an obvious safety benefit for patients. Additionally, the use of systems and large population-based data gathering. So I think there are clinical applications, including forward-loading the monitoring of ECG into non-clinical settings, such as patients' homes, which could then be reported to a clinician, either office-based in the community or potentially in a hospital, and then used to either provide early diagnosis or predict deterioration based on patterns that are emerging in a patient's ECG. We're seeing the use of single-lead ECG wearable monitoring patches, which can be interfaced to wearable devices or can be part of a hospital-based telemetry system. And this sort of technology allows for greater patient mobility. It allows for, I guess, also a degree of more widespread data gathering and amazing research opportunities. If you can imagine a large population of either healthy patients or patients currently undergoing treatments or patients at risk of cardiovascular disease, with wearable devices gathering data interpreted by artificial intelligence-based software, and then informing researchers about the efficacy of treatment or about diagnosis of cardiovascular disease, about cardiovascular risk, and even about stroke risk. So I think that we live in very exciting times, and looking to the future, I think AI, machine learning, miniaturization, and wearable technologies are going to be paramount in this development. So the recent COVID-19 pandemic really tested our health systems globally. I think that single patient use electrodes and lead systems would certainly help to reduce cross-infection. There'd be less cleaning required, and therefore more staff time could be devoted to actual patient care. It allows for patient care to be more individualized, and also protects the patient's skin integrity, especially where they've been monitored for a prolonged period of time, as we saw many COVID-19 patients hospitalized for very prolonged periods. So thinking about the advantages of single patient use lead systems and comparing that with reusable leads, there's certainly less cross-infection, there's less cleaning required and more staff time available for clinical care. The quality and reliability of the ECG traces is certainly much better, and there's less alarm fatigue, which once again saves staff time and has certain human factors benefits as well. There are economic benefits from using a single lead set throughout the patient journey, and I think also that single patient use leads provide for better individualized patient care.